Thank you and good afternoon. Today I'm going to present our data on efficacy and safety of Proact in the treatment of male stress urinary incontinence after surgery with a short-term follow-up. Proact system is a device composed of two adjustable balloons connected to a titanium port placed percutaneously at the bladder neck, just proximal to the external sphincter. Available data in literature are not so satisfactory. We know that there is a very limited short-term evidence according to EU guidelines that show us that they suggest us that Proact is effective for treatment of prostatectomy stress urinary incontinence, but with a low level of evidence. Our study is a multicentric retrospective study. We collected data from databases of 7 centers in Italy. We enrolled 515 patients with stress urinary incontinence who underwent a Proact device implantation for stress urinary incontinence after prostatic surgery. We had incomplete data in 29 patients who were excluded from the statistical analysis. We evaluated efficacy at 6 months follow-up through a 24-hour PED test. We established 3 outcomes: dry if presenting a urine leak count lower than 8 grams at 24-hour PED test, improved if presenting a reduction of urine leakage higher than or equal to 50% compared to the preparatory assessment, and failure if presenting a reduction in urine leakage lower than 50% compared to preparatory assessment. We also evaluated other parameters like perioperative complications, preoperative WLPP, medical history of radiotherapy, volume of balloons at the end of adjustment period, type of guidance, and the impact of each of these parameters on functional outcomes. We observed a significant reduction in mean 24-hour PED test and also in mean number of daily PED per patient. According to previous definitions, about 39% of patients were dry, 37% of patients were improved, and 23% of patients were failed. With a 76.7% of patients dry or improved. Concerning the other parameters, we didn't observe differences as regards the preparatory WLPP, so preparatory WLPP didn't represent a negative predicting factor for functional outcomes. Conversely, we had worse outcomes in patients who underwent previous radiotherapy. We also stratified patients according to preparatory PET test. In patients with a preparatory PET test under 400 milliliters, we observed better functional results. But also in patients with a more severe incontinence with a preparatory PET test equal or over 400 milliliters, we had not so bad functional results with 67% of patients dry or improved. Perioperative complications were found in 42 patients, but the major part of these complications were classified as grade 1 according to Clavian-Dinto classification. To our knowledge, this is the largest published series of patients treated by means of Proact balloons. We had 76.7% of patients dry or improved. Previous radiotherapy reduces the success rate. Severity of incontinence related to success rate, but 67% of patients with preparatory 24-hour PET test equal or over 400 milliliters were dry or improved. WLPP not related to success rate. Complications are usually of low grade, so at short follow-up 6 months, Proact implantation represents a safe and effective treatment option for male stress urinary incontinence after prostatic surgery. Thank you.
So, shall we follow with the second presentation with the midterm results? We make the discussion at the end of the second presentation because it's with the same cohort of patients.
Thank you. So I'm going to present the results of medium-term follow-up data. Design of the study is the same, so this is a multicentric retrospective study. We enrolled 247 patients with a minimum follow-up time equal or over 24 months. In 17 patients, we had incomplete data, so we excluded those patients from the study. Efficacy were evaluated with the same outcomes of the first study, with at the maximum available follow-up through a 24-hour PET test. Coming to results, we had a mean follow-up of 77.5 months, so this is a very adequate follow-up time of more than 6 years. We had a significant reduction in mean 24-hour PET test. We passed from 364 milliliters to about 125 milliliters. So we had good functional results. So we had about 38% of patients dry, 39% of patients improved, and 78.3% of patients dry or improved. We found 46 complications in 44 patients. The most common complications were device rupture. But in the major part of these complications, we didn't require a surgical approach. 15 patients underwent reimplant of prostate balloons. Outcomes after prostate reimplantation were poorer than we observed after the first implantation. We can see that 3 patients were dry, 9 patients were improved, and 3 patients were failed. Coming to conclusions, at mean follow-up of 77.5 months, this treatment seems to represent a good option for patients with stress urinary incontinence after prostatic surgery, with a percentage of cured or significantly improved subjects of 78.3%. Complications rate is 19% at this follow-up. On the other hand, severity of complications is generally low. Thank you for your attention.
What have been the contraindications to not implant the Proact?
Yes, our study showed that radiotherapy basically is associated with poorer functional results.
The prospective protocol that you did, it's not that you had exclusion
not
for radiotherapy? So when there was reduced compliance was not an exclusion, the truthful activity was not an exclusion?
We didn't have this kind of contraindication. We didn't.
Thank you.
May I try also to answer this question? Actually, we don't know exactly the indications of all centers because this was a multicentric center and we are just one of the 9 centers probably. So all centers implanted according to their own indication. So we cannot answer actually your first question. What we have seen is that, as Giuseppe was saying, generally speaking, radiotherapy is a relative contraindication. It reduces a lot the results. But on the other hand, what we want to underline is that the results are not that bad as we may expect. I mean, so I don't think it is an absolute contraindication. And also the severity of incontinence that may represent a problem for the slings, for instance, doesn't seem. It reduces the results rate, the success rate, but it's still around 70%, 67%, so not that bad.
Lanaine Westney, Houston, Texas. I just wanted to, along the same lines, what exactly, though, is the complication rate in the radiated patients? You said overall it's 19%, but you didn't stratify that, so it's important for us to be able to compare that with an AUS in the individual patient.
So we had complications, but we can't say we didn't have a stratification of patient about concerning to complications. So this is a limit of a multicentric study. So the databases don't report the complications according to preparative.
Two presentations, yeah. But we are supposed to finish.
Yes, a bit a comment or a question. If you say stress incontinence, that basically is urinary incontinence syndrome, likely to be stress urinary incontinence, but you have not excluded other causes for incontinence, so that's a bit difficult what group you represent in this study.
Yes, we we can see that also in the study this is a limitation for yes.
I have a very simple question. So, did you evaluate patients' satisfaction?
In some of these databases were made questionnaires and were evaluated also satisfactory patients, but not in all of these databases. So we didn't report also.
Yeah. I mean, vast majority of patients improved. That means 50% of improved incontinence by your definition. So the patient says 10 pads per day, but after this surgery, only 4 or 5 pads. Is there any improvement of symptoms? So they want to be completely dry. In that patient, so you should do artificial swimming surgery. Yeah.
Yeah, you are right, basically. The problem is that, as Giuseppe said, we don't have this data for all the centers. We can answer for our center. And I have to say that, of course, the improved patient means at least 50% reduction. So it may be also 90% reduction. So that's important, an important thing to underline. And in the majority of the patients improved, where we have in our centers, we have this data, patients are satisfied with this treatment. Basically, of course, every patient look for dryness, but improve to the point to have one security pad per day, for instance, is a big improvement for many of them. So the majority of these improved patients in our center are happy with that.
Thank you, Dr. Farullo.
Thank you. Thank you.